Hey there, everyone. How's everybody doing today? It is October 29th at 3 o'clock p.m. and I'm Dr. Nicole. You all know who I am, and I'm so glad that you came in to join me today. Absolutely. I'm going to give you a few moments so that you can invite your friends. You can share this video. We're going to be going over 5 things today that sooner than later. Let me just make sure that my internet. All right. Hey there, Facebook, Instagram, YouTube, and every place that my Talk with the Doc plays. How's everybody doing today? It is Sunday, October 29th. It is 3:03 p.m. And thank you so much for joining me today. You all know who I am. I'm Dr. Nicole, your board-certified family physician. I specialize in treating and preventing chronic medical conditions and explaining those conditions in terms that people can understand. Through my books, my concierge medical practice, my seminars, I help pastors who are overworked, overwhelmed, and overweight, and their congregations to transform their minds, bodies, and spirits so they can live their best lives and they can be better informed to change their lives so that they can have a greater impact on everyone around them. That's their churches, their congregations, their children, their communities. Please do me a favor. Follow me on Facebook, www.facebook.com/Dr. Nicole D.O. That's DrNicoleDO. And tell your friends. Go ahead and share this video today. Like I said, what we're going to discuss today is 5 things that you need to see your doctor for sooner than later. But before we get into that, I do want to just give a quick shout out. It's, like I said, October 29th, so we're at the end of the month. We know that October, lots of people know that October is breast cancer awareness month. Lots of people wear pink for breast cancer awareness. Big ups to all the survivors of breast cancer, to those that have passed away from breast cancer, and to those that are fighting the battle right now with breast cancer. So we do want to give honor to all of those that have dealt with breast cancer, men and women. So that's why I'm wearing pink today. But I'm also wearing purple today. People don't know that this is also Domestic Violence Awareness Month. And we are want to promote domestic violence so that people know about it, that it does occur. And we want to do all we can to educate people so that they don't become victims of domestic violence and so they don't become abusers who do domestic violence. I do want to give a quick shout out to Miss Sarah Alexander. She was a nurse at the VA, where I also am a contracted physician there. And this past week, she lost her life to domestic violence. And so we want to just take a moment of silence for Miss Alexander and for all of her family. We're praying for you, and our thoughts go out to you. She was a wonderful, excellent woman and great nurse, very big heart. And we want to just give a moment of silence right now in her honor. All right. And to anyone that's dealing with domestic violence, please know that there is help. And there are programs out there that can help you. So like I said, that's where I'm wearing purple today, along with the pink for domestic violence and also for breast cancer. All right. So let's talk about these 5 things. 1, 2, 3, 4, 5. In Korean, hana, du, set, net, dao, set. In Spanish, uno, dos, tres, cuatro, cinco. However you want to say it, 5 things that you need to see your doctor for sooner than later. People come to me all the time in my office, and I'll ask them, how long have you had this problem? They'll be like, 2 or 3 weeks. And I'm like, 2 or 3 weeks? You've had this for 2 or 3 weeks and you didn't come in to see me sooner? Well, they're like, well, they didn't know, or they didn't have time, or they couldn't get an appointment. But for whatever reason, they couldn't get in to see me sooner. So I wanted to go over these 5 things that you need to come in and see your doctor for sooner than later. All right. So number 1, chest pain. Now, lots of people know, okay, if I'm having this, the shooting chest pains, feels like a heart attack, it feels like I'm short of breath, I'm sweating, I'm nauseated, that kind of chest pain, people know, okay, pick up the phone, dial 911, get to the emergency room, because that could be signs of a heart attack, right? But there's other types of chest pain that you need to be aware of that you still need to go in to see your doctor about, okay? If you're having burning in your chest, if you're having pressure in your chest, if you are feeling fullness in your chest, if your breasts are hurting, we're going to put all of these in as chest pain, because these are things that you need to see your doctor for. It could be a lot of things. Now, your stomach, with the actual stomach, the part that digests the food, that sits in your left lower chest, okay? And so that's right next to your heart. And so sometimes things that go on in your stomach can affect your heart and can feel like chest pain. So if you have acid reflux, if you have problems with digestion, if you have problems in your esophagus, if you have problems, any problems in your stomach, that can equate and feel like chest pain. And so those are things, those chest pains that just happen, burning in the chest, just happens for a few moments, indigestion that just happens and then goes away. But if these things are recurring and not going away or not getting better, you need to see your doctor sooner than later. Could it be your heart? Absolutely. Which is why you need to not wait and need to get an appointment very soon, okay? You can also, what else is in your chest? Your lungs are in your chest. So things like what we call pleurisy or pleuritic chest pain, that's chest pain that comes from the lining of the lungs. When that lining of the lungs gets irritated from whatever reason, whether it could be a pneumonia, whether it could be an infection, whether it could be, again, your stomach causing pain in the lungs, it can all cause pain in the chest, okay? So those are reasons why you need to see your doctor sooner than later, because those are things that, let's say if it's acid reflux, we can treat that early. If we don't treat acid reflux early, then you can develop what's called an ulcer. An ulcer is where the lining of your stomach basically degrades and it leaves almost like a hole in your stomach, and it hurts really bad. So if we can catch that heartburn and that chest discomfort early, we can prevent ulcers, okay? If we if we catch the squeezing, sudden left arm, chest pain early, of course, we can be preventing a heart attack or something called angina, which is chest pain that occurs when you're active or when you're doing something. That's called angina. And then once you rest, it goes away. But those are things that you need to see your doctor for sooner than later. All right, so that's number one, chest pain. Number two, what do you need to see your doctor for sooner than later? Headaches, okay? Now, do we all get a headache every now and then? Absolutely, it happens. It can happen from congestion. It can happen from sinus pressure. It can happen from stress. Can definitely cause headaches, okay? It can happen from ear problems. It can happen from loud noise. Lots of reasons to cause headaches. But if you are having recurrent headaches that are not getting better with Tylenol or Motrin or aspirin or a pain reliever, you do need to see your doctor sooner than later. Also, if you are having what we call the worst headache of your life, it's the worst headache you've ever had, that's a reason to immediately go to the emergency room and be seen immediately. All right, worst headache ever, go get seen. But if you are having recurrent headaches, we need to find out why. Is this a migraine? Is this a sinus problem? Is this, worst case scenario, could it be a brain tumor? Could it be some neurologic problem in your brain that's causing you to have these headaches? And so if you're having headaches that don't get better, headaches that aren't going away, headaches that are not improving with your common pain relievers, go and see your doctor sooner than later. Why? Because there are medications that we can give you. There are treatments we can give you. There are lifestyle changes that we can discuss with you that can help with headaches. If you're not getting enough sleep and if you're having insomnia, that definitely can cause you to have a headache. If you are, like I said, sinus congestion, ear pain, if you have dizziness along with that headache, those are reasons that you need to see your doctor sooner than later. All right, so number one, chest pain. Number two, headaches, recurring headaches or headaches that just won't go away with common pain relievers. Number three, discharge. Discharge of any sorts. So ladies, that would be a vaginal discharge, a breast discharge, a nipple discharge. Fellas, that would be a penile discharge. If you're having a discharge from your rectum area, guys and girls, if you're having some kind of weird nasal discharge, any type of discharge that's not normal, it's pretty much any discharge, anything that's coming out of your body that's not normal, you need to go see your doctor sooner than later. Probably not be surprised how many ladies I see who have had a discharge for 2 or 3 weeks that hasn't gone away, and they haven't gone to see their doctor yet. Well, ladies and gentlemen, if you have a discharge, please come in and see your doctor sooner than later. There are some simple tests that we can do in the office. We can look at it under the microscope. We can send it off to be tested. Sometimes we can just tell by looking at it what it is. So if you have a discharge anywhere in your body, okay, nasal discharge, a mouth discharge, an eye discharge. Yes, you can get discharge from your eyes. If you have a vaginal discharge, a breast discharge, a rectal discharge, a penile discharge, if you have something oozing out of your body, please come in and see your doctor sooner than later, because early detection is key. If we can figure out what it is, we can treat it and make it go away. All right. And sometimes if you're not treating a discharge early, for instance, things that can cause a discharge in ladies, things like gonorrhea or chlamydia, sexually transmitted infections, if you're not treating that early, that STD or STI can travel up to your fallopian tubes and up to your ovaries, and you can get what's called a pelvic inflammatory disease. And that can be really detrimental later on. So if you've got any type of discharge, come in and see your doctor. All right, let's recap. Number 1, chest pain, go see your doctor. Number 2, headaches, recurring headaches or headaches that don't get better, go see your doctor. Number 3, discharge of any kind, please go and see your doctor. Number 4, if you've had a change in your poop, okay, a change in your stool, a change in your bowel movements. So a change, what does that mean, doc? Well, that means if you've had, if you usually go every day and now you're not going every day anymore, you need to come see your doctor. If you have a change in your color or the consistency of your poop, you need to come see your doctor. Now, we do know that what you eat, so if, for instance, if you have a really big spinach salad or big green salad, yeah, you can have a change in the color. But this would be changes in color that if you've got like white colored poop, or if you've got really dark, almost black colored poop, or really yellowish or mucus in your poop, that's a reason. That could be a reason. If you have white colored poop, that could be a problem with your liver, that you're not, that your liver's not working correctly. If you've got really dark colored poop or really black stools, that could be a sign that there could be some blood in the stool, and we need to test for that. If you've got mucus in your stools, that could be a sign of fat malabsorption and something going on with the liver. So if you've had a change in your poop, we need to know about that. If you normally are having poops every day or every 2 days, and now you're not having them so much, you could be having some problems with chronic constipation. And there are some natural things that we can do to help you become more regular to go. If you're having loose stools where you used to didn't really have loose stools, we got to find out why, okay? You might need a colonoscopy. We need to look and see what's going on so that we can treat that. And some things that can be occurring in your stool, like I said, your liver, your kidneys, or if your iron is low, and because you're maybe bleeding into your stomach somewhere and that's causing your poop to change colors, or if there's something going on in your intestines or in your colon, we need to know about that sooner than later. Of course, getting your colonoscopy when you turn 50 or 45, you know that we talked about this before, that they've recently changed for African American females. They said they're encouraging you to get a colonoscopy at age 45 now. Okay, and men, you should be getting it between 45 and 50 based on your family history. You want to talk with your doctor about that, but you want to get your colonoscopy and you want to get your rectal exams and you want to get checked out, because you know there's a book out for kids. It's called Everybody Poops. And everybody does. That's how we get rid of waste in our body. But if something is changing about that waste, we need to know why. All right. Last but not least, numbness and tingling. All right, numbness and tingling, that weird sensation that you get, feels like your foot is falling asleep or your fingertips are falling asleep. You need to go see your doctor about that. There's lots of problems that can cause that, and the earlier we find out why that's happening, the better we can treat that. Things that can cause numbness and tingling. Diabetes is a really common one. You've heard about diabetic neuropathy, which can become quite painful if that high sugar is damaging the nerves. one of the first signs can often be numbness and tingling. All right. So you want to get that checked out. Other things that can cause numbness and tingling, if there's something sitting on a nerve or pressing on a nerve. For instance, if you've had arthritis in your back or degenerative discs in your back, and now you've got a herniated disc that's pushing on the nerve, that can definitely cause numbness and tingling down the legs or down the buttocks or into the legs, okay? Other neurologic problems that can cause numbness and tingling, so things like multiple sclerosis. Oftentimes we see that that's the first sign and first thing that people complain of is that numbness and tingling that won't go away. All right. There are some benign things that can cause tingling as well. Sometimes, and you know this, if you sit on the toilet too long, you can get numbness and tingling. If you hold your arm in the wrong position too long, or if you sleep with your arm up over if you're laying on your hand too long, that can cause numbness and tingling. This would be numbness and tingling that doesn't go away after a few moments or after a few minutes, okay? We also know things like carpal tunnel. If you're getting numbness and tingling in your fingertips and you're having trouble gripping things, having trouble grasping, and you're having weakness in your hands, we can treat that sooner than later. So if you have carpal tunnel, we need to know about that, all right? All right, so these are the 5 things that I want you to go see your doctor about sooner than later. So let's recap. 1, chest pain, any kind of chest pain, any kind of chest discomfort. If you've got heartburn, if you've got just irritability in the chest, if you just got pain or discomfort with swallowing or anything in the chest, we need to see your doctor sooner than later. 2nd would be headaches. If you've got a headache that won't go away with like Tylenol, Motrin, or aspirin, if you've got recurrent headaches, if you're waking up every morning with a headache, if you are getting the worst headache of your life, you need to be seeing a doctor sooner than later, because we can help. We need to find out what's causing that, and we can prevent that, all right? If you have discharge of any kind, vaginal discharge, penile discharge, nasal discharge, eye discharge, rectal discharge, anything that's coming out of your body that shouldn't be coming out, mucousy, yellow, sometimes with an odor, sometimes without an odor, sometimes burning, sometimes not burning, any type of discharge, please come into your doctor sooner than later so we can figure out what it is and we can treat it and get rid of it, all right? If you've had a change in your poop, number 4, a change in your poop, whether that means a change in the consistency, whether that could be more firm or constipated stools, looser stools, you're not going as much as you used to go, you're going more than you used to go, you've got a change in the color of your poop, so, white poop or dark black poop or, really dark brown that looks almost black, please come and see your doctor sooner than later, because we need to know what's going on with your poops, okay? And then last but not least, numbness and tingling. If you've got numbness and tingling in your fingertips, if you've got it in your toes, if you've got it radiating from your back, maybe shooting down your buttocks, down the backs of your thighs, sometimes down the sides or down the front of your thighs as well. But those are things that we need to see you for sooner than later, because we need to figure out what's causing it so that we can treat it and hopefully prevent some of the more negative things from occurring from those things. All right. So I hope you've learned something today. 5 reasons why you need to see your doctor sooner than later. Listen, I know sometimes it can be difficult to get in to see your doctor, and that's why sometimes people say, I'll wait, or, I understand life happens. You get busy with the kids and with work and with everything that you got going on. And so sometimes our health takes a back burner. But I'm here to tell you, you've got to care for yourself. You got to care for yourself first, because if you don't care for yourself, then you can get really sick, and then you won't be able to take care of yourself or anybody else around you later on. You've all heard of that thing that they say on the plane, in the event of an emergency and that mask comes down, you got to put your mask on first before you can take care of everyone else. So don't let that be an excuse of why you don't go see your doctor. I understand too, people financially, co-pays and the doctor's visits, but I can tell you, if we can prevent problems from happening, big problems happening later, and you just, take care of them early, then you'll actually end up saving money. And then another reason why I've heard people say they don't go to the doctor is because they can't get an appointment. They can't get in to see them. Or let's say you have this headache today, you call and make the appointment, but the appointment is 2 or 3 weeks out. I understand that. Well, there are solutions to that as well. You've all heard me talk about concierge medicine, my new practice that I have started, concierge medicine. There's telemedicine that I also offer so that you can get a quicker appointment with your doctor by either going to an urgent care or by, like I said, getting with the doctor's office that has telemedicine or concierge medicine, where we can cater your healthcare to your needs and personalize healthcare at your service. So at time that's convenient for you, at a location that's convenient for you. And sometimes we can just do it online, okay? So we can answer some of these questions for you online. All right, but thank you so much for joining me today. Again, I'm Dr. Nicole, your board-certified family physician. I specialize in managing, treating, and preventing chronic medical conditions and explaining those conditions to everyday people in terms that they can understand, all right? Through my books, my seminars, and my concierge medical practice, I help pastors who are overwhelmed, overworked, and overweight, and their congregations to transform their minds, their bodies, and their spirits so that they can improve their life and have a greater impact on everybody around them, their children, their communities, their congregations, everybody around them. All right. Please follow me on Facebook, www.facebook.com/Dr. Nicole D.O. That's DRNICOLEDO. And also, when you go to that page, there's a book now link on that page. You can book an appointment with me, either a complimentary appointment where I can tell you more about concierge medicine and what that entails, or you can go ahead and book an urgent care visit with me. You can book a chronic medical condition visit with me. You can book a telemedicine visit with me, and then you can get more questions answered about your medical conditions. All right. Thanks again for joining me. And please tell your friends every Sunday, 3 p.m. Eastern Standard Time, join me for Talk with the Doc. And I will also be on WFMV 95.3 here in Columbia, South Carolina, every month to also do my Talk with the Doc session there as well. All right. Thanks again so much for joining me. This is Dr. Nicole signing off. Have a great day.